planning committee worked to put this conference together. It is my privilege to introduce two women that are just like experts in what they do. We want to talk about and focus on the role of public policy, right, and how that can have an impact, if you will, in terms of health in communities. So we have Rhonda Freeman, who comes here as a part of the County Public Health Department. That one, that's not what you do. County Health and Human Services Public Health. And then we have Julianne Arnett, who is working with CHIP, or the Obesity Initiative. And CHIP is?
It's a collaborative of healthcare systems, hospitals, the County of San Diego, universities in San Diego County working to improve the health department.
So with the two of them here, we have a wealth of information. So with that, I'm going to sit down so that we can go ahead.
Good afternoon. As Diane had mentioned, I'm Rhonda Freeman, and I will be talking from the perspective of public health and how we have kind of changed our thought process from the traditional thought of when people think of public health and looking more so at the social environment and social determinants of health. So I'm going to kind of set the frame up for Juliana, and as she talks about what we're kind of doing in the community, looking at the food justice system. So determinants of health. How many of you, just a quick pop quiz before we get started, what is the biggest determinant of your health status? Is it your genes, is it having a primary care physician, or is it your address? Just on top of your head. Anybody?
Genetics.
Genetics, your address? Address. How many people say address? Raise your hands. Okay, all of you say address. You are correct. It's your address. A lot of times people thought, you know, my mother, my father, they lived till they were 80 or 90 or 100. My grandparents, we have good genes, you know, no wrinkles yet. I'm getting older. I'm looking good. But technically, really, reality is where you live determines your health. What is health? The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely looking at the absence of disease or infirmity. So a lot of times when we looked at public health, we always focused on looking at preventing health disease, monitoring hazards, looking at the problems, but it goes beyond that. It goes beyond just looking at, does someone have tuberculosis, does someone have diphtheria? It expands. And when you look at the social determinants of health, it looks at whether an individual can stay healthy or become ill. Do they possess the physical, social, and personal resources available to them in their communities to achieve their personal aspirations, to satisfy their needs, and to cope within their environment? Our health, basically to summarize that, is our health is a direct result of the conditions in which we live our daily lives. Where we live, where we work, where we play. And it's important for us to start looking at this from that perspective instead of just looking at it, do you have access to a medical provider? A lot of people feel that if you have health insurance and you go to the doctor on a regular basis, that you should be healthy. But not when you leave the doctor's office. What environment are you going back into? For example, if a child has asthma, and so the doctor gives a medication, and so the doctor says, okay, this child, you know, should not be having asthma, should be decreasing. But when they go back in their environment and they may live next to a factory, do they live close to a highway? Does someone in their home have smoke? So even though you're taking care of the child from the medical perspective, their environment totally impacts that, and they may never become healthy. Looking at the traditional public health, like I had mentioned before, we monitor the health status, we diagnose and investigate health problems, we inform and we educate and empower people to take control of their health. And we link families to health resources. But public health recently started looking at, we need to go beyond this. We need to look beyond measuring birth and deaths. And do people have certain diseases? You know, are they getting injured? Do they have access to a doctor? And start looking at employment and unemployment. Do people have jobs? Do they have an income? Do they have levels of stress or racism? That's something that has really been an impact. Looking at infant mortality, for example, in the nation, African-American infants have the highest infant mortality rate, regardless of their income, their educational level of the mother, across amongst all the social demographics, they have the highest infant mortality rate. You would think that if a mother has a great job, you know, she has a PhD, she has access to great providers, why is the infant mortality so high in comparison to other ethnic groups who may have lower educational level? Stress plays a big factor in that, and they have found that racism also plays a factor in that. So you're looking at the social determinants of health. Do they have adequate housing? Do they have systems and policy in place that will help improve their health, which we'll get into a little bit later? The top 10 tips for better health the traditional way was looking at: don't smoke if you can stop, if you can't cut down, follow a balanced diet with plenty of fruits and vegetables, keep physically active, manage stress by talking things through or making time to relax. If you drink alcohol, do so in moderation. Cover up in the sun to protect your children from sunburn. Practice safe sex. Take up cancer screening opportunities. Be safe on the road and learn the first aid, ABCs, airway, breathing, and circulation. Looking all at the individual, saying this is what you need to do to be healthy. Making the better choices. You know, it's an individual choice if they want to smoke or not smoke. That's coming from the traditional public health perspective. Coming from a social determinant factors perspective, the top tips for better health: don't be poor if you can stop. If you can't, try not to be poor for too long. Don't be born to poor parents. Own a car. Don't work in a stressful, low-paid manual job. Don't live in damp, low-quality housing. Be able to afford to go on vacation to reduce your stress. Practice not losing your job, and don't become unemployed. Take up all benefits you are entitled to if you are unemployed, like you're retired or sick or disabled. Don't live next to a busy major road or near a polluting factory. Learn how to fill in the housing benefits application or be aware of available resources before you become homeless or lose a job. Right now, this country is faced with almost a major depression. You have seen people who have been making hundreds of thousands of dollars a year basically being broke and unemployed. They have no clue of public services that are available to them. They do not know that there's a community clinic available to them for health services. And these families are struggling and not knowing what to do. So looking at it from the social determinants of health, now you have someone who has been at this level, they have had access to the most wonderful, the best of everything, who now have been able to only have substandard care if they're aware of that, or not seek care at all. How will their health look now? Before they could have been completely healthy, now you're having someone who may not even go to the doctor, who do not take their children to the doctor because they do not have the resources available to them. Over the past 100 years, we have seen improvement in health. But despite this improvement, there has still exist inequalities and health disparities in this nation, and specifically here in San Diego County. And it depends on where you live. Where is your address? There's an example. How many of you have seen the Unnatural Causes clips? Called Place Matters. An example was, there was a Laotian man who had a heart problem, and the doctor told him, you need to stop working. So if you do not, you will die. You need to reduce the amount of stress in your life. If you do not, you will die. The man is saying, I cannot stop working. Remember, he's in the doctor's office right now, so he's accessing health care. He's saying, I cannot stop working. I'm the only sole support for my family. If I stop working, they will not survive. His son was involved in gangs. He was afraid of his son's life. How can I reduce the stress? His daughter had just been recently killed because of some of this activity. His stress level is up here. The doctor is telling him, you need to remove yourself from your environment so you will not die, so that you will be healthy. That's not an option for this person. They cannot remove themselves from their environment to become healthy. They didn't have access to quality health care. They did not have the means to, the income to move from that environment. So based on his situation, the chances of him surviving or being healthy are very slim. There are so many influences that impact whether we're healthy or not. I circled the